Today, let's solve the 20 multiple-choice questions, which appeared in MBBS first-year exam, September 2025, in Andhra Pradesh. Here, I will explain not only the correct answers, but also why other options are incorrect. This approach will boost your conceptual clarity. Question 1. Which epithelium is best suited for protection against abrasion? A. Simple cuboidal. B. Simple columnar. C. Stratified squamous. D. Transitional. The correct answer is C. Stratified squamous, because stratified means multiple. These multiple cell layers protect underlying tissues from abrasion and injury. Stratified squamous epithelium is found in places like the skin, mouth, and esophagus, where friction and wear are common. Now, let's take a moment to review the other options. Simple cuboidal epithelium. It's too thin and mainly involved in secretion or absorption rather than protection. Simple columnar epithelium. This lines the gut and isn't designed to resist abrasion. And transitional epithelium. Well, it's found in the bladder and has multiple layers capable of stretching, but it's not resistant to abrasion. Question 2. Which of the following is the most abundant protein in connective tissue? A. Elastin. B. Collagen. C. Keratin. D. Actin. The correct answer is B. Collagen is the main structural protein providing tensile strength to connective tissues like skin, bone, and tendons. Let's quickly walk through why the others don't fit. Elastin is important for elasticity, but it's much less abundant than collagen. Keratin, that's primarily a protein of epithelial cells, not connective tissue. And actin, it's a cytoskeletal protein, crucial for cell movement, but plays a minimal role in the extracellular connective tissue matrix. Question 3. Acidophilic bone-resorbing cells located in Hauschilp's lacunae are A. Osteoclasts. B. Osteoprogenitor cells. C. Osteoblasts. D. Osteocytes. The correct answer is A. Osteoclasts. Osteoclasts are specialized cells responsible for breaking down bone tissue and are found in resorption bays called Hauschilp's lacunae. Now, just to clarify the other choices, osteoprogenitor cells are precursor cells that differentiate into osteoblasts, but don't resorb bone. Osteoblasts are busy laying down new bone, so they're on the opposite job. Osteocytes? They're mature bone cells embedded in the bone matrix, maintaining it, but not resorbing. Question 4. The area of skin supplied by a single spinal nerve is referred to as A. Myotome. B. Dermatome. C. Neurotome. D. Dermatomyotome. The correct answer is B. Dermatome. Dermatomes are specific skin areas innervated by a single spinal nerve and are important in clinical diagnosis of nerve injuries. Let's review the other options as well. Myotome refers to muscle groups innervated by a single spinal nerve, not skin. Neurotome is a less commonly used term describing neurons or areas of nerve distribution. Dermatomyotome indicates combined areas of skin and muscle innervation, so it's not specific to skin alone. Question 5. Shindolysis is a subtype of which joint? A. Cartilaginous. B. Sutures. C. Syndesmosis. D. Gomphosis. The correct answer is B. Sutures. Shindolysis is a fibrous joint where two bones interlock, commonly found as a subtype of sutures in the skull. Now, why aren't the others correct? Cartilaginous joints involve bones connected by cartilage, which is different from the fibrous nature of shindolysis. Syndesmosis joints involve ligaments connecting bones but don't have the interlocking pattern of shindolysis. Gomphosis joints are peg and socket types, like the tooth in alveolar bone, distinct from suture types. Question 6. Which arteries mainly supply the growing ends of long bone? A. Nutrient arteries. B. Metaphyseal and epiphyseal arteries. C. Periosteal arteries. D. Anastomotic branches of muscular arteries. The correct answer is B. Metaphyseal and epiphyseal arteries. These arteries specifically supply blood to the rapidly growing metaphysis and epiphysis regions in developing bones. Let's check the other options. Nutrient arteries supply the inner shaft, diaphysis, of bone, rather than the growing ends. Periosteal arteries supply the outer surface of bones, not the growth plates. Anastomotic branches provide collateral circulation but are not the main suppliers to growth areas. Question 7. A 58-year-old man with left MCA infarction shows speech difficulty. Which cortical area is most affected? A. Broca's area in the inferior frontal gyrus. B. Wernicke's area in the superior temporal gyrus. C. Primary motor cortex in the precentral gyrus. D. Angular gyrus in the parietal lobe. The correct answer is A. Broca's area in the inferior frontal gyrus. Broca's area controls speech production. Damage here causes expressive aphasia with impaired speech, but preserved comprehension. Now, why not the others? Wernicke's area affects language comprehension, so damage here causes fluent but nonsensical speech. Primary motor cortex controls voluntary movement, but not language directly. Angular gyrus is involved in language processing, but less in direct speech production. Question 8. During parotid gland surgery, injury to which facial nerve branch causes inability to close the eye tightly? A. Buccal branch. B. Cervical branch. C. Temporal branch. D. Mandibular branch. The correct answer is C. Temporal branch. The temporal branch innervates the orbicularis oculi muscle responsible for eyelid closure. Why not the other options? Buccal branch controls muscles of the mouth. Cervical branch controls platysma in the neck. Mandibular branch controls lower face muscles, not eyelids. Question 9. The anterior choroidal artery is a branch of A. Internal carotid artery. B. Basilar artery. C. Ophthalmic artery. D. Middle cerebral artery. The correct answer is A. Internal carotid artery. This artery arises from the internal carotid and supplies important brain structures. Let's eliminate other options. Basilar artery is part of posterior circulation. Ophthalmic artery supplies the orbit. Middle cerebral artery is a major cerebral artery, but does not give rise to anterior choroidal artery. Question 10. A patient has difficulty straightening fingers after wrist injury. Which nerve injury is most likely? Option A. Median nerve at the wrist. Option B. Ulnar nerve at the wrist. Option C. Radial nerve at the spiral groove. Option D. Musculocutaneous nerve in the arm. The correct answer is B. Ulnar nerve at the wrist. Ulnar nerve injury results in clawing and problems with the ring and little fingers. Let's clear up the other choices. Median nerve affects the thumb and first two fingers more. Radial nerve injury causes wrist drop, but not finger clawing. Musculocutaneous nerve innervates arm flexors, not hand muscles. Question 11. During thyroid surgery, which nerve is at greatest risk? A. External branch of superior laryngeal nerve. B. Recurrent laryngeal nerve. C. Vagus nerve. D. Phrenic nerve. The correct answer is B. Recurrent laryngeal nerve. This nerve runs close to the inferior thyroid artery and is vulnerable during surgery. Why not the other answers? External branch affects pitch, but is less commonly injured during thyroidectomy. Vagus nerve is higher up and not at surgical site risk. Phrenic nerve lies more laterally in neck, protected from thyroid surgery. Question 12. Which scalp layer permits black eye blood spread after blunt injury? A. Skin. B. Dense connective tissue. C. Loose areolar tissue. D. aponeurosis. The correct answer is C. Loose areolar tissue. This layer allows blood to track under the scalp and spread to periorbital areas. Let's check the others. Skin is the outermost layer, tight and unlikely to permit spread. Dense CT holds vessels firmly, doesn't allow much movement of blood. Aponeurosis is a tough fibrous sheet limiting movement. Question 13. A woman has stabbing pain over forehead and eyelid. Which trigeminal division is affected? A. Ophthalmic division, V1. B. Maxillary division, V2. C. Mandibular division, V3. D. Both V2 and V3. The correct answer is A. Ophthalmic division, V1. V1 carries sensory fibers from forehead and upper eyelid. Now, to clarify others. Maxillary, V2, innervates midface, including upper lip. Mandibular, V3, innervates lower face and motor muscles. Both V2 and V3 involvement would cause wider area symptoms not limited to forehead. Question 14. The common carotid artery is best palpated in which neck region? A. Posterior triangle. B. Muscular triangle. C. Carotid triangle. D. Submental triangle. The correct answer is C. Carotid triangle. This triangle provides the most accessible site for carotid pulse palpation. Let's review why not others. Posterior triangle is more lateral, less optimal for carotid palpation. Muscular triangle contains strap muscles overlapping artery. Submental triangle is under the chin, not over carotid artery. Question 15. Which midbrain area controls visual reflexes? A. Inferior colliculus. B. Superior colliculus. C. Periaqueductal gray matter. D. Substantia nigra. The correct answer is B. Superior colliculus. Superior colliculus integrates visual info for reflex tracking and eye movement. Why not the rest? Inferior colliculus processes auditory signals. Periaqueductal gray is related to pain modulation. Substantia nigra is involved in motor control. Question 16. All the following nerves in the orbit are motor except A. Oculomotor. B. Abducens. C. Ophthalmic. D. Trochlear. The correct answer is C. Ophthalmic. Ophthalmic nerve is purely sensory, whereas the other nerves mentioned in A, B, and D control eye muscles. Question 17. Muscle with dual nerve supply? A. Biceps brachii. B. Triceps brachii. C. Coracobrachialis. D. Brachialis. The correct answer is D. Brachialis. Brachialis receives innervation from both musculocutaneous and radial nerves. Let's compare. Biceps and coracobrachialis are supplied only by musculocutaneous, triceps by radial nerve only. Question 18. Supination and pronation movements of the forearm occur at which joints? A. Humeroulnar and humeroradial joints. B. Radiocarpal joint. C. Proximal and distal radioulnar joints. D. Intercarpal joints. The correct answer is C. Proximal and distal radioulnar joints. Only superior and inferior radioulnar joints allow rotational movements of radius around ulna. Other joints are either hinge joints, option A, or wrist joints, B, D, which do not do so. Question 19. During axillary dissection, a nerve supplying latissimus dorsi muscle arises from which part of brachial plexus? A. Lateral cord. B. Medial cord. C. Posterior cord. D. Upper trunk. The correct answer is C. Posterior cord. Thoracodorsal nerve, supplying latissimus dorsi, branches from posterior cord. Structures and other options, A, B, and D, supply different muscles or nerves. Question 20. Which muscle is not supplied by the median nerve? A. Abductor pollicis brevis. B. Flexor pollicis brevis, superficial head. C. Opponens pollicis. D. Adductor pollicis. The correct answer is D. Adductor pollicis. Adductor pollicis is innervated by the ulnar nerve, unlike the other muscles mentioned in options A, B, and C, which are supplied by the median nerve. That completes this episode with detailed explanations for all MCQs. Understanding why other options are wrong helps avoid confusion in exams. Keep practicing, and best wishes for success on your anatomy exams.